Now let's talk about the Norma Lateralis. So I have sketched a drawing showing you the lateral aspect of the skull, just the cranium. The mandible, as you can see, is missing, right? Because mandible we usually discuss separately. It's a separate bone, okay? It completes the facial skeleton, but it is not included in the cranial skeleton, okay? We are looking at the cranium at the moment. So the lateral view of the cranium is showing many bones, right? More than 2 bones. So I have tried to color code them, and we'll start. And again, you can appreciate the sutures, these serrated joints, which are immobile after a certain period of infancy. Like once the brain is completely formed, like not formed, completely developed, okay? And the proportion between the facial and the cranial skeleton has reached its original form, which is the adult form, after puberty. All these sutures become completely immobile. So you can break the bone, but you cannot move it at its joint. You have to keep in mind, right? And that is why an access to the cranial cavity is pretty difficult during the surgical exploration, okay? We do have openings in the skull, but these openings are very busy. They have blood vessels, they have nerves. So it's not easy to explore the inside of the cranial cavity just because of these closed sutures. But we need these sutures. We need this kind of arrangement, which is like a very concrete kind of arrangement, because what the structure that has been enclosed in the cranium is the most vital organ of our body, that is brain, and it's very fragile. We'll talk about it, right? Let's have a look at the bones. So remember, the blue bone was the frontal. Frontal is a very big bone. In an embryo, in the fetal life, the frontal bone develops as 2 pieces, right and left plates. And I told you that as the fetal growth progresses, it keeps on the lower region of the frontal bone fuses. And it creates the elevations that they are known as the glabella, which are the brow elevations. And then the frontal bone has an inwardly running shelf, which is it's also known as the orbital plate of the frontal bone. And if you recall in the lecture of my orbital cavity, I have shown you that the frontal bone is making the roof of the orbit. So this same frontal bone is going in, one of the shelves of the frontal bone is going in and creating the roof of the orbit and inside the inner part of the cranial cavity, okay? We'll take one by one, all right? So the frontal bone, and then you can see half of the coronal suture, the half, like one side parietal bone, like for example, this is my skull. So this is the left side of the frontal bone, the left parietal bone, and this is supposed to be the sagittal suture. This is supposed to be the brachma, where the anterior fontanelle is located in the babies. But in an adult skull, you will not find any soft spot. It's just the brachma or the vertex of the skull. Then you have this orange colored bone, which has multiple parts. Only three parts are visible. There are other 2 parts. Basically, the frontal the temporal bone. This is a temporal bone. The temporal bone is not just a flat bone like a frontal or a parietal. It's a bone with multiple elevations and processes. Okay, so the flattest part of the frontal bone is making the temple of my skull, the side of my skull. Tempus means time. Why we call this region as a temporal region? Because this is the point where our hairline starts showing gray as we age, as the time passes. So we have the evidence of the passage of time or evidence of our advancing age that starts from the temporal region. So the graying of hair starts from the temple. Okay? All right, so the temporal bone, the part of the temporal bone which is flat, you call it the squamous. anything which is flat in the body is known as a squamous. So the squamous part of temporal bone. This squamous part of temporal bone is making a joint with the parietal bone, so we call it the parieto-temporal or temporal-parietal suture. It is like a fan shape, okay? Then there is a process which is extending, like a finger-like projection, extending towards the side of the cheek. And we call it the zygomatic process of the frontal of the temporal bone, because this bone, bone with 2-3 processes is known as the zygomatic bone or the malar bone. This is the cheekbone, the blush area. Okay, so the zygomatic bone, because of the zygomatic bone, this region is known as zygoma. So the process of temporal bone, this finger-like extension, which is reaching the zygoma, is known as the zygomatic process of the temporal bone. Then we have a process which is running at the back of the ear, and it's like a stylus, like a pen, right? So we call it the styloid process. Okay, so this was a part which is flat, the squamous part, articulating or making joints with different bones of the side of the skull. The styloid process is a sharp extension which is running downward towards the neck, and it provides attachment to a muscle and ligament. We'll talk about it. A zygomatic process which is making a joint, a suture with the zygomatic bone. So this whole thing, I will highlight it, this whole thing it's very, very obvious at the back, at the side of the skull, this region. We call it the zygomatic arch. And there is a hollow. This arch is just like a bony bridge that is allowing the passage of certain muscles and vessels from coming on top to bottom and go from bottom to top of the skull. Okay, so this is the zygomatic process. Above the zygomatic arch will be the temporal fossa. Below the zygomatic arch will be the infratemporal fossa. We'll discuss these fossae. These are the spaces when we'll do the facial skeleton and the facial structures. Okay, now, so we have the squamous part of the temporal bone, the 2 processes, the zygomatic process and the styloid process. Then we have another blunt triangular process which was visible here at the Norma occipitalis. This is known as the mastoid process, if you remember. The mastoid process is hollow from inside. I forgot to mention that most of the cranial bones are known as pneumatic bones, because they are hollow. Most of them are hollow from inside because they are mostly membranous bones. They have like a lot of marrow inside, and they have air-filled spaces. In particular, there are few bones which have large air-filled spaces, and one of those bones is the mastoid process of temporal bone. It is lying just behind the ear, and we can feel this bump. It usually is very blunt, almost flat when a baby is born. So you won't be able to feel the mastoid process in a newborn baby. But as the baby starts holding neck and starts moving its neck side to side, the muscle which is responsible for the movement of neck or saying no and yes is known as the sternocleidomastoid. The sternocleidomastoid is going to give attachment on the mastoid process, and it's going to keep on pulling this part of the temporal bone downward, and will create this process. And this process is hollow from inside, air-filled spaces. The clinical relevance of mastoid air-filled sockets or spaces is sometimes in case of middle ear infection, because the mastoid process is related to the ear cavity, especially the middle and internal ear cavities. Okay, so the infection can spread to the mastoid process, and it can infect the mastoid ear cells. And what is lying just above the mastoid process in the cranial cavity is another sinus, dural venous sinus, which is known as the sigmoid sinus. So there are chances of thrombosis, in case of very advanced untreated mastoiditis, the inflammation of the mastoid air cells. Okay, so mastoid process is a very, very important process. First, it gives attachment to the sternocleidomastoid, which is one of the major muscles of our neck movements. And the other thing, it is related to the middle ear and internal ear cavities, especially the middle ear cavity, and it is directly related to the sigmoid sinus. It is filled with air cells, and these air cells, they can get infected as a result of middle ear infection or otitis media. Okay? All right, so here, did you notice that there is something which is like hollow? This is the external auditory meatus or external acoustic meatus. That is the ear, like the whole of the ear, which we all of us can observe. That is located in the pinna of our ear. That is the external opening to the ear cavity. Okay, so the external auditory meatus or acoustic meatus is also a part of the temporal bone. What else the temporal bone is doing? It is providing, there is a shallow concavity present just in front of the external acoustic meatus and the styloid process. This shallow depression is known as the mandibular fossa. That mandibular fossa is a part of the squamous part of temporal bone. That is covered by hyaline cartilage or the articular cartilage and is forming a joint with the lower jaw. That is known as the mandible, and it's a very, very important joint of our head and neck. We call it the Temporomandibular Joint, the joint between the mandible and the squamous part of the temporal bone. Okay, we'll talk about it when we'll do the mandible. All right. So lateralis is being dominated by the temporal bone. Other than that, we can see a chunk of occipital bone, and then this bone, which I have colored in purple. This bone is basically it's one of the key bones. In fact, it is the key bone when it comes to the cranial architecture. The name of this bone is sphenoid, and I'll be referring to this bone time and again. Sphenoid bone. The sphenoid bone, just like the temporal bone, it's not a flat bone. First of all, you cannot observe the sphenoid bone from front. Direct observation is not possible. From side, from top, right? It is located inside. So it is basically creating the foundation of the base of the skull, okay? All the other bones are attaching upon the sphenoid because it's a single unpaired bone. Your temporals are paired, but the two temporal bones are eventually coming and articulating, making joint with the centrally sitting bat-shaped bone or butterfly-shaped bone. We call it the sphenoid bone. Okay, the only part of the sphenoid which is visible on Norma Lateralis is known as the greater wing of sphenoid. As I have just mentioned, that the sphenoid bone is like a bat, and you know that the bat has two wings like on either side. Okay, so there are two lesser wings and two greater wings. So the lesser wings are not visible. The body of the sphenoid is not visible, but the greater wing, a part of the greater wing of a sphenoid is visible at the side of the skull. Okay, now have you noticed, and there is another thing which is purple. One of the structures or the elements of the sphenoid bone is known as the Pterygoid Process. So one of the pterygoid plates, the lateral pterygoid plate, this like fan shape, plate, flat piece of bone, a part of a sphenoid, is also visible. Okay, so we have the zygomatic arch, we have the greater wing of a sphenoid, we have the zygomatic bone. Okay, so this zygomatic bone is a malar bone. It is having three processes. This process is making the lateral wall of the orbit, so we call it the orbital process of the zygomatic bone. This is the process which is meeting or shaking hands with the temporal bone. We call it the temporal process of the zygomatic bone. And this large blunt process is articulating with this big key bone of our face. that is known as the maxilla. So the maxillary process, so the body of the zygomatic bone with three processes is, connecting the lateral aspect of our face. It's like constructing the lateral aspect of our face by articulating with three different bones. With the frontal bone, so we call it the orbital process or the frontal process of the zygomatic bone. With temporal bone, so the temporal process of the zygomatic bone, and with maxilla. Okay, so it's a fixed bone, immobile. Okay, and the significance, the clinical significance of zygoma or zygomatic bone is like it's so obvious. It's like so subcutaneously lying. It's very prominent bone. Anytime when somebody gets a hit on the face, it usually is the zygoma that gets compressed or it gets fractured. Okay, so the zygomatic bone is frequently fracturable bone. Okay, now here just like we have been talking about the sutures bisecting each other or crossing each other like bregma, lambda, here there is like an H-shaped suture, like a fusion of different sutures which gives us the figure of H. So you can see that this is the transverse limb of the H, and these are the two vertical limbs of the H. So now here you can see there are four bones. We can see four colors. A part of temporal bone, a part of the greater wing of a sphenoid bone, a part of parietal bone, and a part of frontal bone. This H-shaped sutural zone is known as pterion. This region is known as pterion, and it has a clinical significance. First of all, this is the weakest spot of the skull, or the weakest spot of the cranium, and it is located in the temporal region of our cranium. The reason why it is weakest because you can see there are so many joints. There are almost four bones involved in creating this pterion. The other functional significance or the clinical significance of the joint or pterion is one of the major arteries supplying the dura mater or the outer covering of the brain is known as the middle meningeal artery, because dura is one of the meninges or the membranes of the brain. So the middle meningeal artery is a branch of the external carotid, and it just climbs up from the region of the face, and it will end up entering through foramen spinosum, an opening at the base of the skull. The middle meningeal artery will enter through foramen spinosum and will lying just behind the pterion. It'll be bifurcating into a posterior and an anterior branch. So the pterion is a landmark for the anterior division of the middle meningeal artery. Now this is the weakest region of the cranium. So sometimes the surgeons, just to reduce the intracranial pressure, just to repair a ruptured branch of the middle meningeal artery, just to drain the epidural hematoma, they use this joint, pterion, to trephine through the skull and remove the clot or reduce the pressure or explore the vessel. So pterion is a very significant point of our cranium. All right. Now, other than that, so this basically was the neurocranium, and this is the viszerocranium. This is the side of the viszerocranium. I'm not exactly talking about the viszerocranium, but we have to mention the bones which are visible laterally. So this is the orbital socket. The orbit has been formed by a part of the frontal bone, a part of the bone which is making the upper jaw, that is the maxilla. So the floor of the orbit has been formed by maxilla, and this is the nasal prominence formed by the nasal bone, right? And this is the nasal aperture, right? the anterior nasal aperture, and this region is one of the maxilla. So just like the frontal bones, the frontal bone is developing as two plates, and then just before birth and then even after birth, the bone fuses and gives rise to a single bone. So is the case with the lower jaw. The mandible develops in the two segments, right and left halves, and then they fuse in the midline and will give rise to a single bone, which is horseshoe shaped. Same is the case with maxilla. The maxilla is playing a very important role because it is like developing in the form of two halves, and then it joins the right and left maxillae, which are holding the sockets for the upper teeth. They join in the midline, and here you can see this spine. So we call it the anterior nasal spine, and this is the midpoint of our upper lip, right, or the philtrum. So the two maxillae join in the midline, and then that's why we have a single hard palate. So we'll talk about the palate, we'll talk about the maxilla, its openings and everything when we'll discuss the Norma Frontalis, or the frontal view of the skull. As far as the lateralis is concerned, I'm pretty sure that most of the bony features are now obvious and you're aware of them. What we have to look at, that the frontal bone, the parietal bone and the occipital bone are almost purely flat plates of bones. They are the typical bones of cranial vault, okay, or the skull cap. But it's not the case with the other bones. Like for example, the temporal bone is having three parts. Only one part, which is flat, like a scale of the fish, the squamous part, is visible from outside the cranium, from outside the skull. The other two parts are visible from below, like from the Norma bizalis, and also from inside the cranial cavity. Those two parts are known as the petrous part and the tympanic part. Okay, so the temporal bone has three parts: the squamous, the flattest; petrous, which is like a mole's hill, like a small mound; and tympanic part. And you can imagine the tympanic part is something related to the tympanic membrane or the middle ear cavity. It has three processes. The temporal bone has three processes: the zygomatic process, the styloid process, and the mastoid process. Okay. One more thing I want you to always remember: everything related to the ear, whether it's external ear, it's middle ear, or internal ear, the entire three ear cavities or auditory cavities and apparatus are located in the temporal bone. Okay, so the temporal bone is actually the house for the ear, for our auditory setup. Excuse me. Then the sphenoid bone is the key bone, is the base bone, which I'm going to show you when we'll look at the Norma bizalis and then the cranial cavity. It's also one bone which is providing a foundation for the other bones to come and attach and make joints. And it is the sphenoid bone is also one of the pneumatic bones. It has the sphenoid air sinus. Okay, so we have a single sphenoid bone, has a body. In that body there will be sphenoid air cells. The frontal bone is having the frontal bone is also having the air filled spaces, not the entire frontal bone, just the anterior segment of the frontal bone is pneumatic. And we have the frontal air sinuses located in our brow region. The maxilla is having the maxillary sinuses. So if you remember that in my lecture on the nose and the paranasal sinuses, I did mention the maxilla. We have a pair of maxillary air sinuses. We have a pair of frontal air sinuses. Then we have the sphenoid sinus. And then there is a bone which is located inside. It is making is contributing in the formation of the wall of the orbit. It's the ethmoid bone, which is also not visible in this joint. But you have to remember that the ethmoid, frontal, maxilla, sphenoid, and the mastoid process of the temporal bone, all these are considered to be pneumatic bones. First of all, they give resonance to the voice because they are hollow bones. So they give resonance to our voice. You must have noticed that during a severe episode of flu, when you are suffering from sinusitis, there is inflammation, impaction of all these sinuses. So the voice, the timbre of the voice changes. Okay? That's one purpose of having these sinuses. The other purpose is to give lightness to this heavy bone, the cranium, which is like a big globe sitting on our shoulder, or sitting on the column of like a very narrow vertebrae, like vertebral band, or whatever you call. Like the vertebral column is just a small, slim cord or rod. On that rod, the globe is resting, and the globe is heavy because it is holding brain, it is holding the structures of special senses and everything. So these cranial bones, most of them are hollow from inside to give lightness to the cranium, lightness to the weight of the skull. So we are done with the Norma Lateralis. We did talk about the significance of zygomatic bone. It is the most commonly fractured bone, and especially the zygomatic arch because it's exposed. So the lateral aspect of the face, if it gets a hit, it usually gets fractured. There are many structures which are lying behind the zygomatic arch, right? Maxilla is comparatively a more stable bone, and it acts like a foundation for the facial skeleton. And the mastoid process is directly related to the middle ear cavity. So any infection of the middle ear cavity can extend to the mastoid process, or any infection in the mastoid process eventually will end up in the cranial cavity and will land in the sigmoid sinus, which is in contact with this process of the temporal bone. All right, now next topic will be the frontal view of the skull, or Norma Frontalis.